Hi, and welcome to this session entitled Exploring the Role of Health Literacy in Addressing Health Inequities in Liberia, West Africa. My name is Crystal Darty, and I am an assistant professor of health communication at Northern Kentucky University. There are two acknowledgments that I want to make before we get started. First is acknowledging the graciousness and my gratitude for the people of Liberia who opened their homes, clinics, and communities for me to conduct my research. Without their hospitality and their trust, I would not be able to share their stories or complete my research. I also want to acknowledge that modern day Liberia, as we know it, was colonized by the United States in the 1820s. There are some political implications, even from the 1820s until now, that show a ripple effect throughout history. And it's important, I think, to acknowledge that they were colonized by the US and then several years later declared their independence. There are three learning objectives for today. The first one is to better understand the role of cultural influences on health literacy. And the second one is to better understand the impact of systematic factors on health literacy and health outcomes. And the final one is to explain approaches to addressing health inequities in your communities, because there are some overlaps, some practical solutions or approaches that we can take away from the research I've conducted in Liberia and apply to here in the US. Let's get started with some background on Liberia. There are 16 recognized ethnic or tribal groups. You will see this broken down here. Obviously, all 16 are not present. A lot of them are so small that they've been lumped together in that 24.5% piece of the pie. The largest group is the Pele group, and they occupy or represent rather 20% of the population in Liberia. For the research that I conducted, most of my participants were Pele, with a few of them also being Kru and Meno. Understanding both the ethnic breakdown and the religious affiliation is really important to better understanding the cultural ground of Liberia. So the religious affiliation, the majority of the country is Christian or identifies as Christian. And the next group is 12% of Liberians identify as Muslim. And then you see here really tiny slivers of traditional belief, less than 1%, and then non-religious or other. I would caution any time I look up a chart or I try to find information about the religious affiliation, it's really hard to get a true reading of this. So I take this with a grain of salt, but the majority of people do, in my experience, identify as Christian. However, what the charts and the data doesn't show sometimes is the number of individuals who may practice or have a religious affiliation with some of the mainstream religious groups, but they also, in conjunction with that belief, so they practice traditional beliefs. So you might identify as Christian, but you also still hold to and practice traditional beliefs. So that's really important, and we'll talk more about that as we get into the presentation. The major health concerns for Liberia are probably what you have thought for the West African, the western side of Africa. So again, Liberia is situated on the west coast of Africa. And so the number one cause of death is still malaria. And this is fascinating. Again, we'll talk more about malaria later, but you can see that the rankings from 2009 to 2019 really haven't, the top three have not changed that much. These are some really interesting, items when we think about Liberia. I would caution there are two that I think maybe fluctuate a little bit, and that is HIV and AIDS, just because in my experience, it's still they're still in the more remote areas of Liberia taboo. There's stigma attached with discussing or even asking questions about um, HIV and AIDS. So, in my experience, when I tried to break through that barrier, I was not successful. And then maternal disorders really go up with, I think probably should or could be ranked higher. But you can see here some of the issues that Liberians are facing. So one of the things I wanted to talk about that again, we are looking at a very complex situation when we look at the health environment in Liberia, coming out of two essentially back-to-back civil wars. There was a time of peace, but during those civil wars in the late 80s and the 90s and even into the early 2000s, war devastated Liberia, and the physical infrastructure is still, and on my last trip, you could still see bridges that had been blown up or were trying to be rebuilt, um, bullet holes into the sides of clinic walls. So the infrastructure is still a major factor. So, and of course, that directly ties into access to healthcare. Um, Paved roads are, if you're in Monrovia, you will be on a paved highway with lots of potholes. But once you get out of the capital city, you will start to see that um, the road situation is not ideal for um, travel. And there are not, of course, like freeways and highways like we have here in the States. So infrastructure and access really kind of are intertwined in this way in Liberia. For those who are living in the remote villages or not living in Monrovia, sometimes there is not a clinic in your community. And from my experience and talking with community members there and healthcare providers, this is a major problem. Of course, we know here in the US, these are also factors that we face. Um, but in Liberia, it's kind of compounded with the back-to-back civil wars. And then, of course, with the Ebola outbreak, that also put additional stress on infrastructure, any type of progress that was being made during the 2 years that Ebola ravaged West Africa. That stuff was halted to focus on the Ebola efforts. Again, access, building of new clinics, pop-up clinics started happening with Ebola. But again, if you could not physically get to the clinic, then those services were not helpful. And then throughout the years, there has been some political and economic stability issues in Liberia. So they are a democracy and based off of the US system, that's what they modeled their country after. So anytime there is a changeover of presidents, there's some unease and maybe a little bit of fear, but especially coming out of those civil wars, just making sure that the political and economic situation remains stable, of course, is a major factor in the funds to one, build new clinics, so money coming out of the Ministry of Health, but also making sure that health and the health of Liberians is a political and economic priority for those leaders. So just a little, all of this is a little bit of background that helps you better understand how we approach health literacy in Liberia. All of the information that I'm pulling or that I'm presenting on is coming out of research that I did in Liberia over the course of 3 years, and this is for my PhD dissertation. Mainly, I did semi-structured interviews and focus groups, and the participants there, I am really proud of the diversity in terms of who was open to talking with me. So I have healthcare providers that really ranged in kind of their specialty. I had individuals who were clinic supervisors. I had trained nurses. I interviewed a doctor. It's a Liberian woman who fled to the US during the Civil War. And while she was in the US, took advantage of being in the States and received her MD from Emory, I believe. And so I got to interview her and some of her clinic supervisors. But then I also had the chance to interview two traditional healers. And in Liberia, they're often referred to as ZOEs. And so from the perspective of healthcare providers, I really did have a nice, diverse group of participants. And then, of course, I had my community members. And I believe it's important to talk to the people who are on the ground, who are receiving services, and better understand how they are constructing health. So one of the big questions that I ask that I think will be important to this presentation is, what do health narratives reveal about health literacy in Liberia? And we don't have time to go through all of the ways or all of the things that the narratives reveal, but I do want to touch on a few of them that may be helpful to you. So we're going to start with the CDC's updated, if you haven't checked it out, they've updated their definition of health literacy, and they've divided that into both personal and organizational. We're going to start with the personal definition. So health literacy is the degree to which individuals have the ability to find, to understand, and to use information and services to inform health-related decisions and actions for themselves and others. So this is a really, I think, the new definition offers us a broader perspective on health literacy, because it brings into not just the individual seeking information, but it also looks at the role of organization. So we'll look at the organizational definition a little bit later. To understand health literacy and to better understand just kind of the cultural implications that come with health in Liberia, it is important to note that Liberia is a collectivistic society. They really value the group over their individual health concerns. So you are not going to put yourself first, and this is in direct opposition of kind of the American, or the view we have here in the US, which is that it is all about me. Liberians also have a long-term view of time, or time orientation. So think back to maybe undergrad when you took a cultural class. So long-term time orientation means that Liberians really value their history, they value traditions, and that is important when you are looking at just the way that they make health decisions. So there is a huge focus on the way things were done in the past, or the ways that traditions are upheld. And finally, they have a really interesting combination of magic consciousness, mythic connection, and perceptival thinking. And you may not be familiar with these concepts, but these are some concepts that some health communication and cultural communication scholars have put together to describe different ways of thinking. And so the first one is magic consciousness. And This is really the belief that every person's body is fused with other sacred spirits and life forces in the universe. Okay, so that kind of falls under a magic consciousness, and then mythic connection is this is to be understood that life and health are a symbolic gift of love and life by one's ancestors. And then finally, the last view is this belief that an object can be dissected and studied. And so in Liberia, you will see varying degrees of each one of these approaches to culture and to health. And this is important because when we are treating individuals, knowing how they approach health or where they think health comes from is paramount to understanding the best way to treat them, the best plan of action. So for Liberians, what I found is that most of them do, have adopted this kind of westernized belief that if there's something wrong, we can dissect it. What's the perception of it, and it can be studied. But underneath that, once you really get to talk with someone, you build trust with them, you will also see that they really start to bring in some of these aspects of spirituality. So this is the reason why I mentioned even religious affiliation. So health is a gift from God or Allah for those who are practicing Christians or Muslims. But also there is a really strong mythic connection that we cannot overlook. And that is this, again, this belief that it can be a gift from the ancestors. This took center stage in the Ebola outbreak. Early on, lots of individuals really believed that their family was being cursed by ancestors, or that their ancestors had done something wrong. What we know now is, of course, that it was Ebola, and that there are medical things that we can do to help maybe try to prevent that from killing individuals. So understanding these things really can make or break how someone treats their patients. Here in the US, most of us adhere to the belief that we can be dissected. We really hold on to that biomedical approach to healthcare. I think we are seeing some shift in maybe some smaller population groups where individuals are being more verbal about this belief in magic consciousness or mythic connection. So it is worth noting that these three viewpoints of health and where health comes from are worth studying if you are someone who practices medicine, not just in Liberia, but in the US. So thinking about these factors, these things we just talked about, I want to tie that into our definition that we're using for health literacy. So we know that the first thing is, can they find information? And for most Liberians, the answer to that is yes. Now, due to, again, the infrastructure, most Liberians do not have a home computer with internet access. So their ways of seeking out health information tends to be in the community or going to clinics. So making sure that community members are well informed, making sure that there's an understanding that if you were to practice in Liberia, that it's not like here in the US where a patient or an individual may look up something on their phone, they're not Googling. So, and the cultural factors here, again, let me go back. Think about if you can understand where your population group believes their health comes from, or um, understand some of their cultural dynamics or beliefs about health, this is really going to help you decide where they're looking for their information. So if this is an individual who believes in this mythic connection, then they are going to seek or going to try to find information from their ancestors. Time and time again in my research, when I ask participants or community members, how do you know this? My grandmother, the village elder. For the healthcare practitioners, especially those, the two individuals who were traditional healers, they found their information from visions and dreams that they attribute to their ancestors. So one individual in particular, he shared that his grandfather will visit him in his dreams to impart information that will help him treat other people. Now, you can agree or disagree with that, but that is the reality for the traditional healer. So we cannot discount those approaches on how individuals find information. Next is to understand. So let's go back. The degree to which individuals have the ability to find and to understand. So in Liberia, very quickly, I realized that they were experts on malaria. They knew what caused it. They knew how to prevent it. They knew that at a certain point, you need to go seek medical treatment. So there is no question that on certain health-related issues, Liberians had extremely high health literacy, which may be surprising to some people, but that's what they're used to. In fact, they would even tell me, well, malaria is not even we don't even consider that being sick. It's not if you are diagnosed with malaria, but when you're diagnosed with malaria. So again, that cultural understanding, so to find and to understand, I think, are connected in the research in Liberia. And finally, to use information and services to inform health-related decisions. So depending on where they fall in this magic consciousness or mythic connection or perceptible thinking, that is going to dictate how that information is used and the services that are used. So if you are someone who becomes ill in Liberia, and you know from community stories or community narratives that have been circulated that you can go and find a Zoe, the traditional healer, and they will help cure you. If that's what you know, then that's the service you're going to seek out. Again, some of this really was highlighted during the early days of Ebola, when a lot of Liberians really were not aware, they didn't understand here what was going on. And so they knew that when you had a fever, when you weren't feeling well, that you could go and you could collect some herbal medicine from a Zoe, or you could collect it yourself and you could treat, fever, you could treat body aches. What they didn't know, of course, or understand was that this was not your typical fever or malaria symptoms. And so they did not understand that they needed to seek other services. So what I have found in my research is that personal health literacy is directly tied to cultural understanding of health. And that cultural belief is sometimes tied in with your religious beliefs. And right, it's kind of a ripple effect, or it's a compounding effect into how individuals seek out care. And so Liberians that I interviewed and interacted with, high levels of health literacy when it came to things such as malaria and maternal issues. Some of the areas that were, and it could be because they were just not as prevalent, lots of individuals were showing maybe some pre-diabetic conditions. And from the clinicians and the doctors I spoke with, they were in the stages of really trying to ramp up that understanding of, what does it mean to be a diabetic in Liberia, and how that influences your other health, you know, issues. So personal health literacy, cultural factors are closely tied into um, how individuals seek care in Liberia. So now I want to look at organizational health literacy. So this is just the degree, again, this is from the CDC and this is part of their new definition, is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So this is one of the areas where I think things can improve in Liberia. So again, we're trying to find, we're trying to understand, and then use the information and services to inform those decisions. There is great mistrust in the some of the more remote areas of Liberia. There have been, again, infrastructure issues, promises of clinics being built that are not being built, access issues, inconsistencies of when some of the mobile clinics are coming through. All of these are issues when we look at organizational health literacy. So the importance here is, I think, one, there has to continue, and there is continued being focus on the infrastructure in Liberia, making sure that that is available, that there are clinics available, and then two, making sure that there's access to whatever type of treatment they may seek out. And this third one is the one that I found to be maybe the most important. So in talking with healthcare providers, some of them were very open and acknowledged that their patients that came into their clinics, they know that they're going to traditional healers before they come to the medical clinic. They know that for a fact. Sometimes the patients that come in or the community members that come in are not as open or truthful with the different medical procedures or treatments that they've received from traditional healers. When I spoke with traditional healers, there was this belief that, oh, well, the biomedical community really hates us and they don't think what we do matters. But look, I have a line of people coming to receive an herbal tea or to receive help for setting a bone. Um, when I talked with community members, they were pretty open with saying, well, I'll go to a traditional healer first because it's cheaper, or because he or she lives in my village, versus having to try to find a ride or walk to the nearest clinic. So one of the things I think in Liberia that is really important moving forward, and this is something to think about here in the US, like how can we encourage, complementary alternative medical protocols? We know in the US that, lots of people will use, different versions or different medical treatments. They often don't just pick, right, a biomedical approach. And the same thing is happening in Liberia. Sometimes it's because of access or necessity, like I don't have the money, I don't have a ride, so the traditional healer is the closest. Other times it is trust. I don't trust the healthcare workers in the local clinic. That was especially true in the narratives that were being told to me when the clinics were ran by NGOs, particularly when the clinic workers were European. So there is some distrust there. So what does all of this mean? Why does it matter? How do we address health literacy and the health inequities that come along with it? My first suggestion for those who might be practicing in another country or who are practicing or providing services here in the US, do not underestimate the power of narrative. The stories that are told about hospitals, clinics, doctors' offices are powerful, both at the individual level and at the community level. The community narratives that were presented to me were fascinating. It really did dictate how an individual would decide on what health services to seek out. So listen to the stories of the people that you are treating or the people that you're interacting with, and see if you can find what they're actually saying. So there's what they verbally say, and then there's what's left unsaid, which sometimes can be just as important. The second one is be open to implementing traditional or non-biomedical healing practices. Of course, this is within the realm of practices that are safe and that don't cause harm. In Liberia, the clinics and the doctors I spoke with, they had a higher level of success with their patients when they were open and supportive of them seeking out traditional healing or including traditional healing. So be open to again, like what is your what are the individuals you're treating or working with saying about how they view health, and that will give us some insight into maybe treatment plans for them. Community clinics are the way to go, but community clinics that are staffed by people who look like the community at large. And this is something that I have found, I think we do sometimes well in the US, other times not so much. But if you are in a community that is predominantly African American, but the only people working inside that clinic are white, again, there could be some trust issue, which leads me to building community trust. Whatever community you are working in, whether it is abroad, in Liberia, or here in the US, I cannot stress this enough. If the community does not trust you, which by the way often comes back to those narratives, what's being said, oh, Dr. XYZ didn't listen to me, I'm never going there again. If that's the narrative, that tells other people that you can't trust this doctor. You can't trust this doctor to listen. And if you can't trust them to listen, then how are you going to trust whatever medical protocol they put forth for you? So building that community trust is paramount and really important to making sure that you have successful patient-provider interactions. So in conclusion, I know we tried to cover a lot today, but hopefully you are able to see the connections between really kind of cultural factors, systematic factors, and how all of that plays into how we understand health literacy, and then how that health literacy can help us address some of the problems that we are facing in the healthcare world. I will field any questions or answers or provide answers where I can. My contact information is available via the conference website, or you can email me with questions at Daugherty, DAUGHERTY, C as in cat, 3 at nku.edu. Thank you.